Every single day, millions of people around the world perform the same deadly ritual. They reach into their medicine cabinet, grab a small white pill, and swallow it without a second thought. They believe this tiny tablet will protect them from heart attacks and strokes. They trust their doctors completely, but they have no idea they might be gambling with their lives. The pharmaceutical industry calls them life-saving medications. Doctors prescribe them like candy. Insurance companies love them because they're cheap. But behind the glossy marketing campaigns and reassuring medical advice lies a dark secret that could change everything you think you know about these drugs. Right now, 200 million people worldwide are unknowingly participating in the largest medical experiment in human history. Recent clinical trials involving over 400,000 patients have uncovered a web of side effects so extensive that it reads like a medical horror story. We're talking about documented risks that could transform your muscles into torture devices, hijack your brain, and literally kill you. The most chilling discovery? Many of these devastating effects are dose-dependent, meaning the higher your prescribed dose, the greater your chances of becoming a victim. Some side effects strike 1 in every 5 users, while others are so catastrophic they can obliterate your kidneys or leave you permanently crippled. But here's the twist that will make your blood run cold. Cutting-edge research has just revealed that some of the most terrifying side effects might not even be caused by the medications themselves. The implications are earth-shattering and could revolutionize modern medicine. Today, we're exposing 15 research-proven side effects that the medical establishment doesn't want you to know. Some will shock you, others will terrify you, and one might just save your life. Prepare yourself for the truth. All right, here are the top side effects of statins, starting from number 1, muscle pain and weakness. Imagine waking up feeling like you've been hit by a truck, your muscles screaming in agony for no apparent reason. According to systematic reviews of 21 clinical trials with 180,000 person-years of follow-up, myalgia affected 190 patients per 100,000 person-years. But here's the shocking truth. In real-world practice, up to 10% of patients report muscle pain, dramatically higher than the 1.5 to 3% reported in controlled trials. Recent groundbreaking research revealed that statins caused only a 3% increase in muscle symptoms, largely confined to the first year. The most stunning discovery? Over 90% of muscle symptoms attributed to statins weren't actually caused by the medication itself. This suggests the nocebo effect, where negative expectations create real symptoms, plays a massive role. The symptoms manifest as deep, penetrating aches in large muscle groups, thighs, calves, shoulders, making daily activities feel like torture. Patients describe feeling like they've been beaten with a baseball bat or experiencing muscles made of concrete. The clinical presentation is so variable that it often takes months to connect the dots between statin initiation and muscle misery. Next, number 2, rhabdomyolysis. This is where statin therapy becomes truly terrifying, a medical emergency so severe it can kill you within hours. Rhabdomyolysis affects 1.6 patients per 100,000 person-years. But when it strikes, your muscles literally dissolve from the inside out. The condition involves complete muscle breakdown, releasing massive amounts of toxic myoglobin into your bloodstream that can cause sudden kidney failure and death. When muscle cells can't produce energy due to statin interference, they begin dying en masse. Picture millions of muscle cells bursting simultaneously, releasing their toxic contents like a biological tsunami that overwhelms your kidney's filtering capacity. Warning signs include severe muscle pain, different from normal soreness, profound weakness, and dark cola-colored urine signaling myoglobin overflow.
This medical emergency requires immediate hospitalization, intensive monitoring, and aggressive treatment. Early detection and prompt treatment can reverse the condition, but delays can result in permanent kidney damage or death.
Next, number 3, liver enzyme elevation. Your liver becomes a battleground when statins interfere with its cholesterol production machinery. Initial trials observed increased liver enzymes in 2% of patients, with elevation often resolving when dosage is reduced. These enzymes, ALT and AST, are like cellular alarm bells, leaking from liver cells when they're under stress or damaged. Research shows both protective benefits and concerning risks. Statins can improve liver enzymes and reduce fatty liver disease progression, yet cause the very elevations that worry doctors. The mechanism involves liver cells working overtime against statin blockade, causing some to become stressed and leak contents. Despite widespread use, acute liver failure remains extremely rare, though statin-induced liver injury is documented. Most elevations are transient, resolving spontaneously or with dose reduction as the liver adapts. However, regular monitoring is essential because severe liver injury, while rare, can be life-threatening. Next, number 4, increased risk of diabetes. Here's the bombshell that shocked the medical world. Statins can actually push you toward developing type 2 diabetes. Meta-analysis revealed statins cause a 9% increased risk of developing diabetes, with odds ratio of 1.09. The mechanism involves upward shifts in blood glucose, pushing pre-diabetic individuals over the threshold. Network analysis showed atorvastatin, 80 milligrams, carried highest risk, followed by rosuvastatin. This dose-dependent relationship means higher intensity therapy carries proportionally higher diabetes risk. Researchers calculated 255 patients need treatment for 4 years to observe 1 extra diabetes case. The irony is profound. Medications prescribed to prevent cardiovascular disease may be creating another chronic condition that itself increases cardiovascular risk. When millions take these medications, even small percentage increases translate to thousands of new diabetes cases annually.
Next, number 5, memory loss or cognitive issues. Patients report brain fog, difficulty concentrating, word-finding problems, and mental dullness appearing within weeks of starting therapy. These symptoms often resolve with discontinuation, suggesting causation. But recent research reveals a stunning paradox. Statins may actually have neuroprotective effects. Large-scale studies show statin use is linked to lower risks of dementia, Alzheimer's, and vascular dementia. Rosuvastatin demonstrated the most protective effect with hazard ratio of 0.72. The mechanism involves cholesterol's crucial brain role. Statins may initially disrupt some functions while providing long-term protection through anti-inflammatory effects. Individual factors, genetics, age, baseline cognitive function likely determine whether statin effects are positive, negative, or neutral. This contradiction highlights the incredible complexity of the brain-cholesterol relationship and the need for personalized approaches. Next, number 6, digestive problems. Up to 5% of users experience gastrointestinal upset, nausea ranging from mild queasiness to severe episodes, diarrhea, cramping, and digestive discomfort. These symptoms typically emerge within weeks and may persist, though many develop tolerance over time. The mechanism involves direct intestinal effects and gut microbiome disruption. Statins can cause inflammation, alter beneficial bacteria, and increase intestinal permeability. This leaky gut syndrome allows toxins into the bloodstream, triggering inflammatory responses throughout the body. What makes these symptoms particularly challenging is their nonspecific nature. Patients often attribute digestive problems to dietary changes, stress, or other factors, making statin identification difficult. This diagnostic confusion can lead to months of unnecessary suffering while the true cause remains hidden.
Next, number 7, headaches. Headaches occur in 3 to 4% of users, often presenting as persistent, debilitating pain, significantly impacting daily activities. These aren't mild discomfort, but tension-type pain or migraine-like episodes with throbbing, light sensitivity, and nausea lasting hours or days. Timing is crucial. Headaches typically begin within weeks of starting therapy, suggesting causation rather than coincidence. The mechanism may involve cholesterol metabolism effects on neurotransmitter production, particularly serotonin and dopamine, crucial for pain perception. Changes in coenzyme Q10 levels might also contribute. Coenzyme Q10 is essential for cellular energy production, and its depletion might affect brain function, triggering headaches. Many patients experience resolution when switching statins or reducing doses, suggesting drug-specific and dose-dependent effects. Next, number 8, sleep disturbances. Sleep problems range from difficulty falling asleep to fragmented sleep with frequent awakenings. Many describe unusually vivid, disturbing dreams so realistic they affect daytime functioning, involving anxiety, conflict, or bizarre scenarios that feel like hallucinations. The mechanism involves central nervous system effects. Cholesterol plays crucial roles in nerve membrane function and neurotransmitter production, so reducing availability might influence sleep-wake regulation. Statins also affect coenzyme Q10 production, essential for brain energy during sleep. Poor sleep quality can affect cardiovascular health, potentially counteracting statin benefits. Patients report daytime fatigue, mood changes, and concentration difficulties, symptoms significantly impacting work performance and personal relationships. The unpredictable nature makes patients anxious about sleep quality. Next, number 9, dizziness. Affecting 2 to 3% of users, dizziness ranges from mild lightheadedness to severe vertigo-like symptoms. Some experience intermittent lightheadedness when changing positions, while others report persistent unsteadiness, making them feel like they're walking on a boat in rough seas. The mechanism involves multiple pathways. Statins can affect blood pressure regulation, causing orthostatic hypotension. Blood pressure drops when standing, reducing brain blood flow. Changes in cholesterol metabolism could affect myelin sheaths surrounding balance-related nerves, making signal transmission less efficient. Dizziness is particularly problematic for elderly patients with existing balance issues and increased fall risk. The symptom develops gradually, making statin connection difficult to recognize. This delayed recognition can lead to dangerous situations where patients attribute balance problems to aging rather than medication effects. Next, number 10, fatigue. Fatigue represents profound energy lack affecting daily activities, with studies suggesting symptoms may be especially prevalent in women. This isn't ordinary tiredness, but persistent, overwhelming exhaustion that doesn't improve with rest. Patients describe feeling like they're running on empty, with significant exercise tolerance decreases. The mechanism involves coenzyme Q10 reduction, essential for cellular energy production in mitochondria. When energy production is compromised, particularly in metabolically active tissues like muscle and brain, profound fatigue results, affecting both physical and mental performance. The impact extends beyond physical symptoms, affecting motivation, social participation, and work performance.
What's particularly concerning is that fatigue often develops gradually, making it difficult to recognize its connection to medication. This delayed recognition can lead to months or years of unnecessary suffering.
Next, number 11, depression or mood changes. Psychiatric complications include sadness, anxiety, irritability, or emotional numbness, ranging from subtle changes to significant depressive episodes. Some patients describe feeling emotionally flat or disconnected from usual emotional responses, with symptoms developing gradually. The mechanism involves brain cholesterol metabolism effects. Cholesterol is essential for neurotransmitter function, so reducing production might affect serotonin, dopamine, and other mood-regulating chemicals. Inflammation and oxidative stress pathways might also influence mood regulation. Interestingly, some studies suggest statins might have antidepressant properties through anti-inflammatory effects. This paradox highlights the complex cholesterol-mood relationship, with individual factors determining whether effects are positive, negative, or neutral. Mood changes can affect medication adherence and cardiovascular risk factors. Next, number 12, skin rash or itching. Skin reactions present as red, itchy patches anywhere on the body, often most prominent on arms, legs, and trunk. Some experience generalized itching without visible rash, while others develop raised, hive-like lesions that appear and disappear rapidly, sometimes migrating within hours. The mechanism involves immune system activation, with statins acting as haptens, small molecules becoming allergenic when bound to body proteins. When the immune system recognizes these complexes as foreign, it triggers inflammatory responses manifesting as skin symptoms. Clinical significance varies considerably. Mild reactions might resolve with topical treatments or dose adjustments. However, severe reactions involving facial swelling indicate dangerous allergic responses requiring immediate medical attention and permanent discontinuation. The unpredictable nature can make patients anxious about skin changes.
Next, number 13, sexual dysfunction. Sexual dysfunction includes decreased libido, erectile difficulties, and reduced satisfaction. While more commonly reported in men, women may also experience decreased desire or other changes affecting intimate relationships. Symptoms can develop gradually, making statin connection difficult to recognize. The mechanism involves multiple pathways. Statins can affect testosterone production, reduce libido and erectile function, and impair vascular processes essential for sexual response. Changes in cholesterol metabolism might affect sex hormone production or nerve pathways involved in arousal. The impact extends beyond physical symptoms, straining relationships, reducing self-esteem, and contributing to depression. Many patients are reluctant to discuss these problems, potentially leading to medication discontinuation without medical guidance. This silence prevents proper evaluation of alternative treatments. Next, number 14, peripheral neuropathy. Peripheral neuropathy involves nerve damage causing persistent pain, numbness, and disability, particularly with long-term high-dose use. Symptoms begin as tingling, burning, or shooting pains in hands or feet, described as pins and needles or electric shocks. Over time, symptoms progress to numbness, weakness, and fine motor difficulties. The mechanism may involve cholesterol metabolism effects, compromising nerve membrane integrity, impairing signal transmission. Coenzyme Q10 impacts might affect nerve cell energy metabolism. The condition can be irreversible if allowed to progress, making early recognition crucial. Symptoms develop gradually over months to years, making statin connection difficult to recognize. Regular neurological monitoring may be warranted for long-term users, especially those on high doses. Next, number 15, cataracts. Recent studies suggest slight increases in cataract surgery rates, with rosuvastatin showing higher risk than atorvastatin. The Lodestar trial found rosuvastatin incurred higher cataract surgery risk, raising questions about long-term eye safety in aging populations already at risk. The mechanism remains speculative. Statins' cholesterol metabolism effects might influence lens proteins responsible for clarity. Oxidative stress pathways might contribute to lens damage. The relationship might be indirect through diabetes risk increases as diabetes accelerates cataract formation. Cataracts are extremely common regardless of medication use, making causality challenging to establish. However, consistency across studies suggests long-term users may benefit from regular eye monitoring, particularly those with other risk factors like diabetes, smoking, or excessive sun exposure. These 15 research-proven side effects reveal statins' complexity beyond simple cholesterol lowering. From muscle pain affecting 20% of users to rare but serious rhabdomyolysis, from cognitive changes to diabetes risk, statins influence multiple body systems in ways we're still discovering. The key insight: most side effects are manageable, dose-dependent, and must be weighed against substantial cardiovascular benefits. Latest evidence shows small muscle risks are much lower than cardiovascular risks, with diabetes risks already accounted for in overall cardiovascular protection. What's striking is that many feared side effects may not be directly caused by statins themselves. The nocebo effect, where negative expectations create real symptoms, plays a significant role. This suggests better communication and education could reduce unnecessary anxiety and improve outcomes. The future lies in personalized medicine approaches, optimizing dosing and monitoring for individual patients. Different statins carry different risk profiles, and what works for one patient may not suit another. This underscores the need for careful monitoring, open communication, and willingness to adjust treatment plans. Never stop statins without consulting your healthcare provider. The goal isn't avoiding all side effects, but finding the right balance for your situation. Open communication about symptoms is essential for optimal care and can help distinguish between medication effects and unrelated issues. The cardiovascular benefits have been proven in numerous trials, preventing millions of heart attacks and strokes worldwide. For most patients, benefits far outweigh risks, but understanding these side effects enables informed decision-making. Now, I want to hear from you. Are you currently taking statins? Have you noticed any of these 15 side effects we discussed today? If yes, how are you managing them? Share your experiences in the comments below. Your story could help others facing similar challenges. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Don't forget to like, share, and subscribe for more evidence-based health content. Thank you for watching.